So, Dr. Mamarian, I just saw one of your patients in clinic for follow-up.
Okay.
She's a 47-year-old African-American woman, history of hypertension and hyperlipidemia. I'm here for evaluation of her blood pressure and her cardiac risk. She doesn't really have any risk factors besides a previous history of smoking, 5-pack years.
How physically active is she?
She runs about 1 to 2 miles a day.
Okay. And does she have any symptoms, any chest discomfort, shortness of breath?
She's currently asymptomatic, no symptoms.
Great, great.
She recently had her lipid profile, which showed cholesterol mildly elevated at 210 with an LDL of 99. Her physical exam showed a blood pressure of 130 over 80, heart rate of 76. She didn't have any other significant findings. Resting EKG showed a normal sinus rhythm at 71 beats per minute.
Okay, so in summary, we have a relatively young woman who has several risk factors for coronary disease, but is completely asymptomatic, has a normal physical examination, has a normal resting ECG, and that would put her at least at what would be considered to be low risk for having coronary artery disease.
Okay.
So how would you like to proceed with her?
Well, given that she does have a smoking history and her lipids slightly elevated, would she benefit from getting a cardiac stress test?
Well, I really don't think so, because at this juncture, in an asymptomatic individual who's at relatively low risk based on standard criteria, myocardial perfusion imaging is really not indicated.
Well, she is fairly anxious, so would there be any downside to doing this test?
Well, potentially. First of all, remember that more than likely she will have a normal study. And if she were to have an abnormal study, that might very well be a false positive abnormal study, which could lead to then more radiation exposure and from other procedures down the line. So I think at this juncture, reassurance is probably the best way to approach this, and to also very aggressively treat her risk factors, including her hyperlipidemia.
Right.